Welcome back to the town hall. As the nation soars to more than 23 million COVID infections, there's growing frustration about the slow rollout of vaccines. Many people who are eligible here in Western New York have a lot of questions as they're trying to sign up. Earlier this week, we asked for your vaccine questions in particular. And Kate, we got a ton of them, to say the least.
We really did. And we did sort through them and took some of the most common ones to one of the nation's leading infectious disease experts, Dr. Carlos Del Rio. He is the chair of the Hubert Department of Global Health at Emory University in Atlanta. And first, viewers were texting us wanting to know about the rollout. Tom from Buffalo texted, what seems to be the holdup with the COVID vaccine distribution? Logistics, training, locations? Dr. Del Rio explains that while a lot of money has gone into vaccine development, very little went into distribution. And that part, he says, is complicated.
Imagine if we were fighting a war and I would be giving you bullets and develop bullets, but then I got the bullets down to the states and then told the states, okay, it's up to you guys to, buy rifles and recruit soldiers and then put together the armies and then start fighting a war. It'll be really complicated, right? If I didn't give you resources to do that, you will still have a bunch of bullets stored and you will still try to figure out how to get them to people. So the reality is that we need to get resources to the states so they can actually start doing the vaccinations. And then we need to really be very innovative. I'm very excited to see things like, for example, Walt Disney setting up a vaccination site, the Met Stadium turning into a vaccination site. We have to take vaccination outside of healthcare and put it in the community and put it in places that it's very easy to have not a few, but thousands of people come through. And then we need to be vaccinated long hours, from 8 in the morning to 8 o'clock at night or later. And we need to be vaccinated on weekends.
All right, let's move to another common question that we're getting. Once you've received the vaccine, how long does it take for immunity to begin? And how much protection do you get from the first dose? Remember, both of the ones available right now require 2 doses. Dr. Del Rio says that there are just still a lot of unknowns about all this.
We don't know if even after getting 2 shots, you are immune from getting infected and transmitting the virus to others. What we know right now is that the vaccines protect you from getting sick, but you may still get infected. And we will know in a few weeks to a couple of months if the vaccine prevents you from infection. But at this point in time, yes, you can still probably get infected. And that's why we tell people that have been vaccinated to wear a mask. I've received my 2 doses of vaccine. I'm one of those lucky ones that's already been immunized. And yet I'm still wearing my mask. I still socially distance. I'm still doing the exact same things I did before. I'm just more relaxed internally because I know that if I get infected, the chances of me ending up in the hospital or even dying are significantly decreased.
Some good perspective there. And we have 2 more quick questions for the doctor. Some of our viewers are saying they've had allergic reactions to the first vaccine. This person told us they saw some redness, inflammation, and some itchiness at the site. They want to know if they should still get the second vaccine. And the doctor says, yes, you should.
Those are not allergic reactions. Those are actually immune reactions. We call that reactogenicity. That means your immune system is responding to the vaccine.
All right, and then to our last question for Dr. Del Rio, this person asking, for those who are vaccinated, how long do people need to keep practicing the usual pandemic precautions like travel restrictions, staying 6 feet apart, and wearing a mask? And again, going back to what he said earlier, you're going to need to be patient when it comes to all of that.
Oh, it's going to take some time. Even if we go to the rate that is being proposed by President-elect Biden of 1 million people immunized per day for 100 days, we're still talking about late summer to early fall where things can start looking more normal.
Yeah, a bit of a rough timeline there for people wondering when things are going to get back to quote unquote normal. It's going to be a while because remember, we're supposed to hit that herd immunity mark before we can stop doing all these safety precautions.
Right. It's a good step forward, but still a long road. And I think that can be tough for people to grasp onto and understand.
Yeah. We got 4 down, 1 million to go in terms of questions, Kate.
Yeah, I know. But keep them coming, please.